Life Support Skill Center, Multidisciplinary Research Unit, Indian Oil Corporation or Hohojugot 32 slice CT scan tekhet hokole amak borongoni hisabe agborhaise mor Indian Oil Corporation loi बहुत धन्यवाद आरो आमार molecular oncology उपरतो আজি আমি ইয়াতে খুব state of art laboratory এটা উদ্বোধন কৰিছো মই ভাবো যে prevention and control of cancer ওপৰত আমাৰ যিমানখিনি প্ৰচেষ্টা তাত আজিৰ এই molecular labে যথেষ্ট আমাক সহায় কৰিব আমাৰ ৰাজ্যৰ medical sectorত হগহনাই সন্মুখীন হোৱা আমাৰ এটা ডাঙৰ problem হৈছে যে equipments maintenance আমাৰ obviously in our medical college we cannot provide 2 MRI or 2 CT scan 3 CT scan so asset maintenance is a very big challenge for us মই ভাবো যে আটাইতকৈ আমাৰ আজিৰ দিনত সমস্যা যে এখন মেডিকেল কলেজত যেতিয়া মেচিন বেয়া হৈ যায় আৰু তাক অন টাইম যেতিয়া আমি ৰিপেয়াৰ কৰিব নোৱাৰো পেশেন্টৰ বহুত বেছি অসুবিধা হয় we are constantly trying to address the issues that how in Assam we can put a very good maintenance team je amar jate machine beya nohoy till the lifespan that is why we introduce CMC that all our equipment will be backed by comprehensive management but there are many equipment where in spite of the agreement the engineers come at a very late and a lot of patient has to face the kind of agony so today we are starting a asset management portal at least now we will know that how many equipments are not in order when we have asked the company to repair how much time they are taking and all this can be considered when we are trying to award a fresh order to the company because maintenance is the key the company who is not good in maintaining the equipment I think they do not deserve fresh order so this asset management portal will be a great help towards our maintenance of assets properly মই পুনৰ এবাৰ স্বাস্থ্য বিভাগক আজিৰ এই সুন্দৰ অনুষ্ঠানৰ বাবে ধন্যবাদ জনাইছো আৰু মই আশা কৰো যে আমাৰ স্বাস্থ্য বিভাগৰ যেটো উত্তৰণ সেই উত্তৰণ অব্যাহত থাকিব বিশেষকৈ ক্ৰিটিক্যাল কেয়াৰত আমি কন্ট্ৰিবিউট কৰিব পৰাটো আমাৰ কাৰণে এটা বহুত ডাঙৰ সৌভাগ্য মই নাজানো why but in spite of our best effort in last 2 years road accident case ami komabo pora nai every day is number is increasing we have we tried to rectify road we introduce many best practices we force people to have helmets everything whatever in our command we have done but still we are not able to so far we have not able to reduce road traffic accident cases to the DGR level and we can save life only when critical care is in place otherwise we cannot save lives so moi bhabu this is very important for us aru aji ami jitu kam korisu tar folafol definitely ami pam and I feel happy that our hospital like Hailakandi, Karimganj, they have become very proactive. Our health sector at a gaps asile. The certain district we could not offer the health care to the desired level primarily because of geographical remoteness and also due to motivational factor. So if in our state Haflong, Karimganj, Hailakandi hospital gets award for motivation then this is a very important landmark so moi atai kekhon chikitsalay ko dhonnobad janai punor ebar apunalok hokoluke dhonnobad janai moi mur বক্তব্যৰ সামৰণি মাৰিছোঁ ধন্যবাদ